Antibiotics are essentially chemicals that kill or at least deter the growth of biotics, which means bacteria. While we might think of antibiotics as only medicines or something produced by drug manufacturers, as we will discuss, antibiotics are also produced by microorganisms as they seek to protect or retain their territory. In other words, antibiotics are chemical warfare agents used either by humans or yeast and bacteria to kill off those bacteria who threaten survival. Accordingly, antibiotic medicines manufactured by pharmaceutical companies may be produced in the laboratory or by microorganisms. Some are based upon antibiotics produced by probiotics, and some were simply discovered by exhaustive testing by drug companies. Still, a number of antibiotics are produced by yeast or bacteria cultured and manipulated in such a way that they mass-produce the biochemicals according to tight specifications. In this manner, antibiotic production is extremely standardized. The first antibiotic discovered, penicillin, was discovered by Alexander Fleming in 1928. Penicillin is produced by the fungi in the genus called Penicillium. While the concept of antibiotics was first discovered and even observed by ancient scientists, Louis Pasteur and Robert Koch first described how a bacillus bacterium can inhibit the growth of Bacillus anthracis in 1877. One of the first commercial antibiotics produced was tyrothricin, which was derived from the probiotic Bifidobacterium brevis. This was used for treating a variety of wounds through the Second World War. Since then, antibiotics became synonymous with medicine, being one of the primary foundations for the growth of today's pharmaceutical companies. Today's antibiotics are often blends or mixtures of different antibiotics. Just about any infection today will be treated with antibiotics, often even if the root cause is viral or fungal. According to the Centers for Disease Control, nearly half of patients with upper respiratory tract infections in the U.S. still receive antibiotics from their doctor, even though 90% of upper respiratory infections, including children's infections, are viral, meaning the antibiotics will have no benefit. The CDC thus estimated that at least 40% of the some 50 million prescriptions for antibiotics given each year by physicians were inappropriate. According to the CDC, 4 out of 5 Americans are prescribed with at least one course of antibiotics each year. Today, antibiotics are prescribed so widely in Western countries that patients now request them, and studies show that patients who request antibiotics are more likely prescribed antibiotics by their doctor. Even more concerning is that in some countries such as India, antibiotics are sold over the counter. Yes, in a country with one of the highest rates of infection due to poor sanitary conditions, anyone can walk into a drugstore and buy antibiotics over the counter. Antibiotics are also obtained easily within skin creams and wound bandages most everywhere. These types of antibiotics, which include neosporin and polysporin, are now often ineffective against bacteria such as Staphylococcus species due to the fact that bacteria have learned how to evade these antibiotics. Antibiotics are given to animals and people with little second thought. Antibiotic use has soared over the past few decades. Today, over 3 million pounds of pure antibiotics are taken by humans annually in the U.S., and 25 million pounds of antibiotics are given to animals each year. Antibiotic use globally is now rising even faster, growing by more than a third in just the last 10 years, from about 65 billion units in 2000 to nearly 74 billion units in 2010. In addition to this, even more chemical antiseptics are being introduced for use around the world. Much of this is produced for hospitals. The common hospital antiseptic is chlorhexidine, but there are many others, including chlorine. As a result of this gross misuse of antibiotics worldwide, the growth of multi-drug resistant bacteria such as antibiotic-resistant E. coli and many others is expanding. Many of these multi-drug resistant E. coli infections are now coming from factory-farmed animals, due to the fact that animal farms are now using antibiotics profusely. The National Antimicrobial Resistance Monitoring System reported in 2010 that more than 75% of meats from chicken and turkey were contaminated with E. coli, a majority of which was resistant to multiple antibiotics. NARMS also reported that 59% of ground beef meat and 40% of meat products from pork were also infected with E. coli, again with most being multiple antibiotic resistant. These superbugs are causing tens of thousands of deaths in the US each year. In 2013, researchers found that some 23,000 Americans died from superbug infections, and scientists reported that some 60,000 infants in India died from superbug infections. Researchers have found that the fastest growing superbugs are multi-drug resistant E. coli, which cause a variety of intestinal, blood, and urinary tract infections. Multi-drug resistant Klebsiella pneumoniae, which cause pneumonia, blood, and urinary tract infections. Multi-drug resistant Staphylococcus aureus, which cause wound and skin infections, blood infections, and others. Multi-drug resistant Streptococcus pneumoniae, which causes pneumonia, meningitis, ear infections, and others. Multi-drug resistant Salmonella, which causes foodborne infections, bloodstream infections, and intestinal infections. And multi-drug resistant Shigella species, which cause dysentery. You can see from this diagram the difference between a non-resistant colony of bacteria and a resistant colony. As a single colony-forming unit bacteria multiplies into a colony, should it meet with antibiotics, the entire colony will die. Should a bacterium become antibiotic resistant, as it expands into a colony, will continue to thrive even when antibiotics are given. When a bacteria figures out how to become resistant to a particular antibiotic, it will typically pass this information on to its brothers in the same colony, and then to other bacteria in other colonies, and even different strains and species sometimes. As we can see from this diagram, bacteria utilize the transfer of genes through plasmids to pass on this knowledge from one to the other. As each receives the new DNA and then divides, the antibiotic resistance grows exponentially. Here's a scenario of a particular bacterium, in this case Mycobacterium tuberculosis, that becomes increasingly resistant. In this slide we see it as resistant to one or two antibiotics. The bacteria colony will be resistant to those particular antibiotics, but will still be vulnerable to others. For this reason, doctors will escalate the treatment of antibiotics to tougher antibiotics when they are treating a patient with an antibiotic-resistant infection. The question is, when will the bacteria become resistant to all antibiotics? Some species are doing this. Recent research has found bacteria resistant to some 12 to 14 different antibiotics, with few or nothing remaining. Now we see that M. tuberculosis is becoming resistant to more antibiotics. We see that even the second-line drugs considered the go-to drugs for strains that have become resistant. Such is the situation now for many cases of tuberculosis around the world, as infected people are transmitting increasingly resistant strains of M. tuberculosis bacteria. This slide illustrates how different antibiotics work differently. For example, rifampin inhibits the formation of RNA, and fluoroquinolones inhibit the enzyme gyrase, which is an enzyme which coils DNA. Other antibiotics such as capreomycin and kanamycin will interfere with the formation of proteins within the bacteria, and still others such as isoniazid will mess with the cell wall. In this way, a bacteria might become resistant to one of these, but still another antibiotic which works differently might still work. But as a particular strain of bacteria becomes stronger, becoming a superbug, it has learned to evade all the different forms of static antibiotics.